Hello, I'm Dr. Marisa Weiss. I am Chief Medical Officer of Breastcancer.org and Director of Breast Health Outreach at Lankino Medical Center. And I'm here today with Barbara Jordan, a great friend and colleague who is an integral part of the team of palliative care and hospice at Mainline Health. Barbara, I wanted to ask you about palliative care. This service being available to people with a serious problem to help them improve their quality of life, including symptom management. Is it true that somebody who's had cancer, who's finished their treatment, but who has symptoms left over from the treatment and who needs help managing those symptoms, let's say they have pain or aches or discomfort or certain things they can't do as much as they could do before, that they would qualify for palliative care?
I believe they would qualify for palliative care because although they're finished with their treatment, it does not mean that they are without symptoms that can alter everybody's day, and symptoms that should be managed in a way in which the patient is still communicating with their physician, touching in, and has additional support, because no matter what, cancer, even after treatment, is scary. So bringing together a team of individuals who get to know you well, who can support you from many aspects, is really important.
Absolutely. And a lot of times when you're finished treatment and you don't feel like you're back to normal yet, and you have these leftover lingering symptoms that are often invisible to other people around you, and your family, and you may be yourself kind of impatient, like, because you really want to be back to normal again and jump back in, and you don't feel quite, you're not yourself yet, or you're not strong enough yet, or you're limited with discomfort or aches or pains, whatever, that it's really important to know that the palliative care team has a deep understanding of what you're feeling, and they can be absolutely indispensable, really listening to what you're experiencing, trying to sort out the different symptoms that you have, figure out practical solutions for managing them, by altering your lifestyle or by medications or by talking to an expert, getting emotional support, spiritual support. Like, all these things can be really indispensable, even when you're finished treatment and you think you should be celebrating. But you need a little extra help to get back into the groove of things, right?
That's so true. Just finishing treatment really doesn't shut the cover of the book down hard. Partly because our families are kind of strewn across the United States or elsewhere. And after treatment, you do have a feeling of aloneness, no matter how supportive family can be and friends. And I think the other thing is that patients sometimes feel that they have been burdened their family or caretakers while they went through treatment, and therefore can be very hesitant to talk to them about aches and pains and fears and whatnot, whereas they're comfortable talking to the palliative care team.
Right. Well, thank you so much for sharing. That's so important to know.